This is a medical procedure that 1 in 3 women will undergo in their lifetime.
As women, we just need to stick up for each other and support each other.
An abortion is when a pregnancy is ended so that it doesn't result in the birth of a child. In fact, 1 in 3 women will have an abortion in their lifetimes. The majority of abortions happen in the first 8 weeks of pregnancy, and 60% of people having abortions have already given birth. A legal abortion is much safer than giving birth. Abortions are actually one of the safest procedures in medicine. Fatalities are less than 1 death per 100,000 procedures. In fact, people are more likely to die from pregnancy and childbirth than as a result of an abortion. There are 2 types of abortion, a surgical and medical abortion. In this video, I will only be discussing a medical abortion. This is where 2 pills are taken to end a pregnancy. In combination, the 2 abortion pills are 98% effective if taken in the first 10 weeks of pregnancy. The first pill is called mifepristone. This blocks the hormone called progesterone, causing the lining of the uterus to break down. The uterus contracts and the embryo is expelled. Misoprostol is taken 1 to 2 days later. It can be taken orally or vaginally. This causes the cervix to open and the uterus to contract. This causes heavy bleeding and clots for a few hours, and the pregnancy is expelled within 24 hours. This is like a really heavy, crampy period and is similar to a miscarriage. BPAS, or the British Pregnancy Advisory Service, is a British charity and is the leading provider of abortion services in the UK. During the COVID-19 pandemic, BPAS have provided an abortion pills by post service to women across the UK. The UK government is currently deciding whether to make this a permanent service. I'm about to talk to Catherine O'Brien via Zoom call. She's the Director of Communications and Campaigns at BPAS.
So BPAS is a charity. We were set up in 1968 after the Abortion Act was passed. And this was a time when abortion was legal but not widely available. So we see around 100,000 women a year for a range of reproductive healthcare services, mainly abortion and contraception. So since the start of the pandemic, BPAS has been able to provide early medical abortion to women directly to their homes. So this means that women are able to receive the medication by post following a telemedical consultation. And they can now take that medication in the privacy and comfort of their own home. Since telemedicine was introduced, waiting times have fallen significantly, and women, as a result, have been able to end the pregnancies at the earliest possible gestation.
I am now going to talk to Katie Hills, who is a safeguarding midwife at BPAS.
So I am the safeguarding midwife for BPAS. I have been a midwife since 2012, worked in the NHS. I was a midwife for a number of years. Then I was a manager of a ward, and that's when I moved over to BPAS. We are really pushing for body autonomy, and no matter what you want, whether you want it's a wanted pregnancy or an unwanted pregnancy, we provide that service, non-judgmental, and we support you for every step of the way. So if pregnancy isn't right for them at the time, then they need just as much support as everybody else. It's such a shame, isn't it? It's the same with pregnancy and everything like that. Everybody likes to talk about the really horrible stories and the awful stories, whereas actually there's a lot of positive stories. And by people talking about it a lot more, we're going to hear a lot more positivity around it and how it's helped more people than it has hindered.
What telemedicine has shown us is that for the vast majority of women, that an in-clinic appointment is just completely unnecessary, and it adds a burden and an extra hurdle for women to jump through in order to access care. So I think that abortion medication should be available from your GP, or your GP should be able to write a prescription for your pharmacy. I don't think, as I say, BPAS were established in the 60s because the NHS wasn't providing abortions. But there's no reason why you shouldn't be able to visit your GP for abortion care, other than the fact that the law prevents it. It's a medical procedure, and therefore it should just be subject to the same regulations as all other medical procedures. When the Abortion Act was passed, this was a time when abortion was seen as much more risky. It was largely surgical. So when you think about the majority of women today can end a pregnancy just by taking some pills at home, really there's no reason that it should be this sort of standalone service. And at a time when, everything with COVID, the NHS is massively overstretched, why would you waste doctors and nurses and midwives' time?
So ideally, these pills would be readily available, that the women can access them without, the need to speak to a doctor. I think there should always be a service there for women to talk to somebody. Because I think that's really important, especially some of the things that these women need support with. But it shouldn't be about whether we then agree whether she's entitled to an abortion or not. We should just be there to support her and her decision. That's what an ideal world would look like, that a woman can talk freely about what she wants. And what, if she doesn't want to talk about why she doesn't want a pregnancy, that's absolutely fine. But we are there to support her needs, and then she makes the decision solely herself on whether she wants to continue with the pregnancy or have a termination. I understand that we need somebody to make overarching rules in this country, but we definitely need to listen to the voices of our women and what they want. Our Pills by Post service has been absolutely phenomenal for some women, especially these women that can't access services, that can't come to a clinic. It's meant that they haven't had to continue a pregnancy that they just did not want, and they've felt safer doing it. And sitting in a room with a blood pressure machine and an ultrasound scan machine is quite normal to us as midwives, but to women it's really scary and daunting, and you're not going to open up to someone when you're in that environment. So sitting in your own home with your slippers on and your cup of tea in your hands, it's just more relaxing.
Currently, 2 doctors must sign off to approve an abortion.
So when the 1967 Abortion Act was passed, abortion was largely a surgical procedure, which is why in the law you'll find lots of references to doctors, because it wasn't expected at that time that nurses and midwives would be performing abortions. This was solely for doctors to perform because it was a surgical procedure. They felt that by having the 2 doctors' signatures, that would sort of be a safeguard for doctors. So it wasn't just one person authorising an abortion. They almost had the backup of a colleague. So the 2 doctors' signatures was put in, to sort of help doctors feel able to provide abortion care. And it's just crazy to think that is still in place today. There is no other routine medical procedure that requires the approval of 2 doctors. And I think that people would find it quite disgraceful that in this day and age, women still have to have the approval of 2 doctors. You don't have the right to an abortion. You have the right to request one, but ultimately you need 2 doctors to approve it. And they have to approve it on the grounds that the abortion meets the grounds of the Abortion Act. So that a woman's mental health would be harmed if the pregnancy continued, that kind of thing. It's strange because I don't think that even women who have an abortion would know that that is a procedure that has to take place, that 2 doctors have to approve it, because most women having abortions will never see these 2 doctors. These 2 doctors will never talk to women. They are literally just there to sign paperwork, and that's a huge waste of time. At BPAS, we employ doctors who sit in a room and their job is just to sign forms. I don't want to be pregnant should be a good enough reason, but under our current law, it's not.
Women should have body autonomy. Absolutely. They should make the decision on whether they want to be pregnant or whether they don't. It shouldn't be down to 2 doctors to decide whether a woman should continue with a pregnancy or not.
Improve sex education and access to contraceptive services reduces the number of abortions by preventing the number of unwanted pregnancies. Alongside current short-term contraceptive methods like the pill and long-term contraceptive methods like the coil, future sexual health clinics could offer a once-a-month contraceptive pill. Birth control pills work great if women remember to take them every day, but missing a dose can lead to a surprise pregnancy. Now scientists have figured out how to pack a month's supply into one pill capsule. The pill could work both by preventing any fertilised egg from implanting in the lining of the womb or detaching it if it had already done so.
So under the current law, if you were to take a medication that dislodged a fertilized egg from the lining of your womb, that would be an abortion, and to do so you would need the approval of 2 doctors. So in other parts of the world, there have been trials of a medication which has similar properties to the medication involved in early medical abortion. But this is a medication that women could take if their period was late, or if they'd had sex that month or unprotected sex that month. And you wouldn't necessarily need to take a pregnancy test. You could just know that when it was time for your period to be due, you could take this medication and that would bring on your period, and that would mean that you weren't pregnant. And I think that would be a really great solution. You know, for lots of women, you know, having a daily pill is something that, you know, can be forgotten, or lots of women just don't get on with the current offer of contraception. When we've spoken to women, you know, it's something that they would really welcome just as an option to try. And it's really sad that, you know, the law as it stands prevents women from using this kind of a method. And because of the law as it stands, we won't be able to have any trials of this product in this country.